Hi, my name is Melinda and I will be going over the workflow of ordering and processing of a blood transfusion as well as a type and cross. First, we will start with one order to transfuse 1 unit of packed red blood cells. Go ahead and begin clicking on the telephone written orders on the left column once, and go ahead and enter the order date and time. And for the order author, we'll go ahead and choose a physician and double click that as well. Click continue. Under the order selection, go and scroll down to common orders. Click once. Go ahead and scroll more. Click blood product transfusion once. Depending on the order, for our case, it's going to be red blood cells. Go ahead and click once in the box and add order. From here, you're going to see a problem list. To bypass that, click OK once. And depending on the doctor's order, we'll go ahead and do a routine today. Double click that. And the reason for a blood transfusion, for this we'll do a hemoglobin of less than 7. Now it's asking for how many units, so we're going to do 1. Okay. And also a cross match. Basically a cross match is a type and cross depending whether in the past 2 days or 72 hours if it was taken. We're going to go ahead and put yes. But since this is a new order and a new patient, we're going to click no. For an add-on RBC unit, it's basically asking if there was an original cross-match order. If not, press no. If yes, and there was a type cross within 72 hours, go ahead and click on that. However, in our case, it's a new patient, so no. Now go ahead and click the readback and hit OK. And on the top, you can see the blood product transfusion RBC is in your queue of orders. By now, we could hit order summary and accept, and filing started, which would go to our inbox. For us to see the order in our inbox, we'll go ahead to the little house with the little person, click that, hit the inbox tab, and refresh. And there you see, one order is new. Go ahead and double click on that. We're going to review the order of blood product transfusion. Select all, sign and review. Exit out of here, and there we would go straight to our work list. And you see here that there are 3 main tasks needed to be done: blood product pickup form, consent, and the actual transfusion. First, we need the consent, assuming at this time the consent is signed. So go ahead and double click the blood transfusion, input the document as well as the time. We'll just say now, then OK. As you can see, go ahead and answer the following questions. We'll do yes, yes, English, yes. Go ahead and accept that. And that's being filed. Once that is done, we're going to go ahead and wait for the lab. We're going to see if they get the blood and the type and cross. Once we know the type and cross is done and the blood is ready to pick up, we'll go straight to a blood product pickup form number 1. Double click that. We'll go ahead and document, hit now, assuming everything is done, of course, and ready. Has cross-match for requested units been previously done? Obviously, because the lab has came, so yes. Go ahead and answer the following questions listed below in the transaction line. So yes, it's available, and yes, the consent is signed, and yes, the vital signs are taken. At this point, we need a verification with another RN, so I'll go ahead and input that. So go ahead and get it verified by number 2. And we'll go ahead and remember to fill in all the blanks. We'll continue editing and be verified by myself. Okay, so once you're done with that, click OK and accept. This will automatically generate a printout at the printer at the nurse's station. You would then use that form to pick up the blood product downstairs. Once you have received the blood, we will go to the blood product transfusion number 1. Go ahead and double click that. Again, we will document once the blood is ready to go and ready to be hung, and then the time. Okay, for here we have a unit donor number. Usually it's on the bag, and it usually starts with a W, ending in various numbers. In this point, we'll just put W, 1, 2, 3, 4, 5, 6, 7, and put that. As of right now, it's asking about the input of the patient. Since we are starting it, we're going to put not applicable. And this is basically towards the end of the transfusion. Example, 4 hours past, the transfusion is done and there's no reaction, so go ahead and hit no. And we're going to accept. During the time, however, of the 4 hours, you are going to have a separate sheet where you put in vital signs and also verify with another nurse. This will be attached to the blood that was also picked up. This concludes the workflow of a blood transfusion.